Okay, I'm aware that everybody is obviously on a schedule and everyone's very busy, so we'll get started now that we're at 1:30, but there's no problem if people are running a bit late and people might keep joining. So good afternoon, everybody. Thanks again for joining. Just before we start, to let everyone know so that it's clear that this session will be recorded so that a video can be sent around to all registrants afterwards. Please also keep an eye on the chat section during the webinar, where we will put messages and be answering questions. Finally, we'd just like to request that everyone checks that they are on mute, please, just to save any background noise causing distraction. So today is the 8th episode in our series of online training webinars called Mastering Seating Assessments. Today's event will be all about the provision of seating for people with Parkinson's disease. So we're very pleased to welcome Caroline Sturdy as our guest speaker today too, who I will introduce in a few minutes. So I'm sure you're looking forward to hearing from Caroline as much as we are. So here we have the agenda for today's session. So we're going to look at the various symptoms and health risks that people with Parkinson's disease live with that should be looked for and considered when specifying seating for them. We'll discover how to support them with proper postural and positioning solutions, and much more. We'll then learn about different chair types that are available and the functionalities that these can have to offer to your patients to enhance their lives. And then these will be brought to life at the end by Ben Sterling, who is one of our in-house seating assessors, who will demonstrate what some of these functionalities look like on actual chairs from our range. At the end of the webinar today, we will have a live Q&A session, so please keep a note of any questions you'd like to ask. You can pop these on the chat during the presentation for us to discuss at the end. Otherwise, you are welcome to unmute and ask them when we give you the prompt during the Q&A at the end of the session. So before I introduce Caroline, I just would like to give you a quick overview of Vivid Care to you, who are hosting the webinar this afternoon. Some of you may have joined our webinars before, but for those who are joining for the first time, we have been supporting the healthcare sector for over 50 years now. We were previously known as Yorkshire Care Equipment, the name of which some may recognise, especially those local. But we're now called Vivid Care to represent the work that we do right across the UK, both within hospitals and the community. So our mission, as you can see there, is to enhance lives through advancing care, and our focus is on providing specialist care seating, profiling and hospital beds, and then also mobility equipment. So we're really working every day to enhance the quality of life of the people we work with, and those especially with complex care needs, by supporting them and healthcare professionals such as yourselves with the best resources and equipment possible. We're actually part of Core Care Group, so our sister companies include Innova Care Concepts, who specialise in hoisting and installed healthcare projects. And then there is Aquadapt, who help with home adaptations. So without further ado, I'm very pleased to hand over to the experienced hands of Caroline Sturdy, who has worked in occupational therapy for many years. Welcome, Caroline, and we're looking forward to hearing a little bit more about you and your background and then your presentation. I'll just
Thank you.
Stop sharing my screen and allow you to share yours.
All right, thank you. Oh, it's disappeared. Hang on a second.
It's okay. Make sure that you've got the ability.
I sent my actual PowerPoint presentation. So much for practicing, but my PowerPoint presentation isn't actually an option on my share screen at the moment.
Okay, I can bring it up for you if you need.
That would be good, even though it's there. Why? Oh, hang on. Let me just try something else.
Okay.
There we go. All right, I got it.
Cool. There we go. We can see that.
Okay, can everybody see that and also see me somewhere on the screen? Can you confirm, Braden? Can you see it all right?
I can, yeah, thank you.
Perfect. Okay. Okay, so hi everybody, my name's Caroline. I am an occupational therapist. I qualified 22 years ago now, started working in the NHS before moving into the community. My main experience is with housing, rehousing, as well as adaptations, and assessing for a provision of equipment, manual handling equipment, and also obviously assessment and provision of specialist seating as well. Just so you're all aware, because I appreciate people are probably joining from various places. I'm actually based down in South Wales, so being a Welshie, we do have some slight variances in terms of funding which I'll talk about at the end. I just wanted to make you aware, just in case anybody more local to Vivid Care is asking location relevant questions later on. Okay. So I'm going to start by giving a brief overview of Parkinson's. I'm not going to claim to be an expert in Parkinson's disease by any stretch of the imagination, but I have worked with a lot of clients at various stages of their diagnosis. I don't know if anybody has seen, but on the Vivid Care website, there's actually several other webinars, or a couple of other webinars in the resource section on the website regarding how Parkinson's can be diagnosed, how it progresses, treatment options, and symptom management. And it gives a bit more detail there, so it might be worth having a look at that. I'm then going to look at key areas that we need to consider when assessing for seating. Many of the considerations are going to be the same regardless of the client group, but there are some specifics, specific considerations to take into account with clients with Parkinson's. I'm going to do a very brief overview of measuring for seating, and then also have a chat about funding streams as well. So, as I mentioned a few minutes ago, take a look at the Vivid Care website in the resource section, because Parkinson's UK have done a webinar, and then a slightly older webinar from a Doctor in Nottingham NHS Trust as well, goes into a little bit more detail of developments in Parkinson's research and everything, and it's they're pretty good, pretty interesting watches, to be honest. So if you wanted a general overview, that's a good place to go. And in summary, Parkinson's is a progressive neurological condition. The average age of diagnosis is 60, although it can occur at any age. There isn't one test or scan that provides a diagnosis of Parkinson's. It generally is through looking at a person's symptoms and then providing the diagnosis. There are also several other conditions that have a lot of the same symptoms as Parkinson's, so those need to be ruled out as well. Nerve cells that make dopamine in the brain basically die off. So people with Parkinson's don't have enough dopamine, and their movement is therefore affected. The reason for that is pretty much unknown, despite lots and lots of advances in research. But there's suggestions that environmental factors such as chemicals used in farming, as well as genetics and age, all play a part. Symptoms include motor and non-motor. So your typical motor symptoms include a resting tremor. And a tremor will normally disappear when a person is distracted or during function. So it's a lot more prevalent when somebody is at rest. You also have bradykinesia, so lots of slow movements, rigidity, so you either get the cogwheel rigidity where there's small stop and start movements, for example when you're bending your elbow, or there's lead pipe movements where there's a general increase in resistance through the range of movement. Another motor symptom is hypermimia, so that expressionless face that you quite often see with Parkinson's disease as well. That's often a telltale sign. Non-motor symptoms then include cognitive changes, altered sleep patterns, pain, anxiety, and depression. And many people with Parkinson's describe changes in their symptoms depending on where they are in their medication regime. So, for example, someone's mobility may improve soon after taking medication, and then deteriorates as that dose wears off. And that's often referred to as on-off symptoms. So it comes on and off like a light switch. The cognitive changes seen in Parkinson's are common. Around 75% of people with Parkinson's who survive 10 years or more will go on to develop dementia. And the risks of developing dementia increase if the person's motor symptoms are more severe, if they have a reduced baseline cognition as well, and people that have got REM sleep behavior disorders, so anybody that sort of acts out their dreams in their sleep, all at higher risk of developing cognitive changes. So we'll have a look through assessment. I don't know whether all of you are OTs or whether there's some physio colleagues, nursing colleagues here, but you know, typical OT, we're looking at assessing the person, we're looking at how that is impacting on function, we're looking at their environment, and we're looking at their occupations, what they need and what they want to be able to do. So you've got a new referral for someone with Parkinson's disease requesting a seating assessment, or if you're already working with somebody with Parkinson's disease and during your intervention you realise that their seating that they currently have is not suitable anymore, then what should you consider? So we need to make sure that we assess all of these areas to make sure that the seating is as suitable as it can possibly be. It's also really important to, as well as speaking with the client or service user patient, however you refer to the person with Parkinson's, it's also really important to speak with their family and any carers, so that it helps to paint a picture of how that person's abilities change at different times of the day as well. So you might go and see somebody and they're functioning really well. You might be going to see them shortly after they've taken their medication, for example. So it's really important to gather all of that information, so you've got the situation from all angles, and you can see whether somebody's worst case scenario in terms of their presentation and their function. So we obviously already know that the person's got Parkinson's. We also need to consider any other medical conditions that may also impact on function, and take that into consideration throughout the assessment and when making the recommendations. Obviously, for the purpose of today, we're just going to focus on somebody with a diagnosis of Parkinson's. And as well as assessing a person's mobility and their transfers, we also need to consider range of movement when they're sitting. Are they able to raise their arms? Are they able to move their head, move their neck, move their lower limbs? And is that passive movement or is that active movement? Is there any rigidity, or are there any contractures that you can feel when you're assessing that range of movement? There are several Parkinson's symptoms that can impact on seating recommendations that we might make. So freezing episodes. So we've probably all seen people with Parkinson's who freeze when they're walking or when they're transferring, and it's like they're stuck to the floor, and that's a common description of a freezing episode. Freezing episodes can present themselves when they're initiating movements, such as when you're standing from a chair or when you're turning to sit and approach the chair before sitting. You need to be mindful of that when considering the seating options. For example, is the person likely to freeze with a riser recliner in its raised position? During the freezing episodes, a person's legs might shake, and that increases the risk of falls. So how will the seating options that we're thinking about impact that, and how can we minimize the risk? We need to assess a person's dexterity as well, especially when you're considering mechanical seating options, and if they're going to be operating the chair themselves, are they going to have the dexterity to press the buttons of any mechanical chair? Tremors, as we've said, is also another common symptom of Parkinson's that affects around about 70% of people. Mainly affects the arms, the legs, feet, and jaw. And as I said before, predominantly tremors occur in rest. So sitting in a chair, watching TV, listening to a radio. So we need to look at the tremors. Is a person's tremor likely to increase the risk of skin damage through friction with any body part that is in direct contact with the chair? Dyskinetic movements. So dyskinesia generally occurs later on in the Parkinson's disease progression, and they're different to tremors. They're a lot more fidgety and irregular, and it can vary in severity as well. So you might have dyskinetic movements that affect one part of the body, or it might involve the whole body. And some people with Parkinson's can use their dyskinetic movements to help with their function. But there's a fine line, I guess, and if it tips into the more severe movements, then it can hinder a person's function, really. So as with the tremors, we need to look at the dyskinesia. We need to see whether it's going to impact on what sort of chair we recommend. And if the dyskinesia is severe, it can be so bad that it can cause a person to slide off furniture as well. So slipping off edge of bed or slipping off the edge of the chair. If somebody has that sort of severe dyskinesia, then we need to look at options that can help to minimize risk. So whether we're looking at one-way glide sheets, whether we're looking at cushions with a ramped front, a ramp edge, tilt in space, or lap belts. Although just a little note on lap belts is that we obviously need to use caution there, because we need to make sure that the lap belt isn't actually going to be posing a risk in itself. So that needs some careful consideration and probably completion of a risk assessment as well. Postural changes with people with Parkinson's. So generally have the altered head posture, the rounded shoulders, and that can impact on comfort when looking at seating, and also impact on the person's ability to participate in the activities that they want or need to do, such as feeding, if they're going to be using the chair and sitting out and having breakfast, lunch, dinner. Could also impact on their ability to watch TV or engage socially with their family or any visitors that they've got. We also can often see people with Parkinson's have a tendency to lean to one side. So we need to assess the extent of the postural changes to make sure that the seating's appropriate. So is the person able to self-correct with some prompts, whether that's verbal prompting or whether that's physical prompts from a lateral support? Will that then bring them back into midline? Is that the chair that you might recommend for somebody who is able to self-correct might be very different to one that for a person that leans over time and is unable to self-correct even with some prompting. Person's sleep pattern and any fatigue might also impact on their position, so it's important to consider if the person's posture changes the longer that they sit out, or if they're likely to fall asleep in the chair, if they generally have an afternoon nap and would prefer to do that in the armchair. Autonomic disturbance such as incontinence or constipation or drooling, we need to consider that so that we make sure that pressure relief is adequate, but also the material of the chair is also suitable. We need to be mindful of somebody's history with skin integrity. So we want to make sure that we're liaising with any nurse colleagues that might be involved. You know, if you work in the community, does the person already have some repose products? Do they have a hospital bed with an airflow mattress? We know that then we need to consider pressure relief. I'll go on to talk about how pressure relief products can impact on posture a little bit later, but those repose products that you may be familiar with can obviously cause difficulties in themselves in terms of posture and positioning, and impact on a person's ability to stand, actually. So we'll talk about that a little bit later as well. We need to consider the person's pain levels. So how does that pain manifest itself as well? So dyskinesia can cause an aching type pain, or the person might experience pain due to spasms or dystonia. And we need to know whether they can communicate that pain as well. For somebody that isn't able to verbally communicate, they may actually move themselves more in an attempt to get comfortable, and that in itself might be an indicator of pain. We also need to obviously consider a person's cognition in terms of assessing for seating. Are they able to learn to use the controls of a new chair themselves, if that's the aim? Do they experience any hallucinations that might impact on their ability to sit out? Are they likely to get out of the chair unassisted? And is the chair going to be a hindrance or a help to that? So where the person is in relation to their disease progression is going to impact on what chair is recommended. So you go and see somebody who's in the earlier stages of the diagnosis, or whose medication is better managing their symptoms, and they remain mobile and independently transferring. That person's going to need something very different to a client in the latter stages of Parkinson's, or who's at the end of life care. We need to know what the chair is going to be used for. Is it a case of a person, you know, they're used to getting up in the morning, they sit in their chair, it's part of their normal daily routine? Has sitting out been recommended by nursing staff to help with posture, change of position, or pressure relief? Do they plan on sitting out in the chair all day until bedtime? And if so, how frequently can they get up from the chair? So again, someone who's independently transferring is going to be very different to somebody who relies on a package of care coming to assist with their transfers 2, 3, 4 times a day. We need to know if they're going to be eating in the chair, if they're going to be engaging in hobbies in the chair, or is the chair more for end-of-life care, where the focus is more on comfort and position and helping to reduce contractures. Environmentally, we need to make sure that there's space for the chair, both in its upright position and also when it's in its tilted position. And it's also really important to look at who's going to be using the chair. Someone whose carers or family are going to be moving or altering the chair will need a bit more thought than somebody with a more basic style of riser recliner chair. I worked with somebody who had Parkinson. Have I been muted?
We can hear you, Caroline.
Oh, you can. I've got a message
Yeah,
saying
yeah.
I've been muted. Sorry.
Okay, that's all right.
I worked with a elderly gentleman who lived at home with his wife, had carers coming in, but she wanted to be able to adjust the chair, and he had a specialist care chair. So we were doing assessments with that, and because of the wife's diagnosis of arthritis, and it impacted greatly on her shoulders, she just couldn't get the leverage to alter the chair from the back, and that was justification in itself to consider a chair that the wife could use through a remote control, so all the functions were remote control based. So it's also important to consider the ability of any other people that are going to be using the chair as well. And obviously we need to make sure that if a chair is being moved between rooms, that we're looking at level flooring, we're looking at wide enough doorways, that kind of thing. So again, I'm not sure. I think we've got a load of OTs on here, so I don't really want to teach anybody to suck eggs, but I'm going to go over this briefly, really. Taking measurements of a person is essential to make sure that the current or future seating is suitable. So we need to measure the person's hip width, the seat depth, the popliteal height, or the length of the from the back of the knee to the floor. We need to measure from the base of the back up to the head, the top of the head, and we need to measure for the armrest height as well. And getting an appropriately sized chair is going to offer the best comfort for the person. We obviously don't want the seat to be too small, as that can impact on comfort, increase the risk of pressure damage, cause difficulties with care tasks if the person's hoisted, for example, and carers are looking at removing and refitting slings. Equally, if the chair's too wide, then the armrest won't offer adequate support. In regards to the seat depth, we want to make sure that the chair supports the entire length of the upper leg. Too short, and it's going to increase the risk of too much pressure going through the area just behind the knee. Too long, and the person might end up sitting in a bit of pelvic tilt and a lovely slumped position. The floor to back of knee height, make sure that we're not putting too much pressure on the thighs if the seat is too high, or too much sacral pressure if the seat is too low. And the seat to the top of head height is important, because we want to make sure that backrest is giving adequate support to the head as well as shoulders down. The armrest height is one that I find people tend to forget. We want to make sure that a person can comfortably place their arms on the rest of the chair, help with comfort, and also help to minimize the risk of leaning if the armrests are too low. And measurements should ideally be taken when a person's in sitting and using a metal tape measure. And I'm sure we're all aware, but if you're measuring across the hip, you want to do it straight across, not bending the tape measure. Otherwise, you're going to add centimeters onto the seat, and you'll end up with a chair that's too wide. So we should always look at why the person's current seating isn't meeting need anymore, and look at exploring adapting the existing seating before we consider alternatives. And not only does that have less impact on the person and any family members that they live with, but it also obviously has less financial implications on the person that is funding the equipment. So generally that's easier to do for someone in the earlier stages of the disease, or for someone whose symptoms are milder or better managed. So good old chair raisers, and we also need to consider chair raisers for riser recliner chairs. They do exist, even though I'm still hearing OTs saying that you can't raise a riser recliner chair. You can in certain situations. We might look at one-way glide sheet, or we might look at a stand easy type piece of equipment for someone who continues to remain mobile but just struggles with that initial stand. I've worked with somebody with Parkinson's in the past who loved their two-seater sofa. It was her and her husband's really cute little afternoon routine where they would sit next to each other, hand in hand, watching afternoon TV. It was really important to them both that they could do that for as long as possible. And initially we were able to make that work. You know, we were able to raise the sofa so it was a better functional height for her transfers. And at that time, her postural changes weren't quite so bad, that the armrest being on the side that she leant to, it gave her adequate support. After a period of time, I then had to introduce a one-way glide sheet, but then her posture changed pretty quickly after that, and she started experiencing quite severe dyskinetic movements. So she needed something a lot more supportive, but she then agreed to that. I think the fact that she was able to continue to use her sofa for the length of time she could. She knew that I'd explored different options rather than just saying that it wasn't suitable. It really helped to support our client-therapist relationship, and ultimately it meant that she was a lot more accepting of the change to more specialist seating when it was really needed. So generally, first port of call when somebody starts to have difficulty getting out of their chair, if raisers and things like that haven't been explored, is a riser recliner, and that might well meet need for some time. I have had issues with people who have bought from high street stores where salespeople just don't have the knowledge to advise appropriately, and then people are spending money on something that doesn't suit their needs. So the chair might be too wide, it doesn't have tilt in space, or they've been persuaded to purchase a lazy boy type, really wide, really deep, really low leather chair. And some of the difficulties with these chairs is generally it stays in one room. It can't be moved easily between rooms. We can look at raising these chairs if it is too low. It's still, even though the chair does assist with standing, it's still really important to make sure that the base height, so this upright default position of the chair is suitable, so that the hips and the knees are at 90 degrees if possible. So if the base height of the chair is too low and the chair otherwise meets the person's knees, then exploring chair raisers might just resolve the issue and allow them to continue using that chair for a while. The backrests on these types of chairs tend to come in standard waterfall type backrests, or a basic lateral support that is built into the cushion here. With the waterfall, it's quite often possible to remove some of the padding from some or all of the sections. So for somebody with mild postural changes, that could also be a first port of call, is to look at whether some of the padding can be removed to help a person sit more comfortably. The pressure relief options on these types of chairs tends to be more limited, and this is where you might get your nursing colleagues providing repose cushions. There are, the repose contour cushions, which are a full length, and they're designed for riser recliners, but I've still had nightmares with those with people. And you know, the issues of placing cushions on those chairs can cause a person to struggle to move themselves back on the chair, especially if they have that dyskinetic movement, and but they're able to reposition further back. There might be some resistance against the repose, despite the fact that the repose cushions for riser recliners strap around the chair. Sometimes they become loose and aren't checked by people, and before you know it, the chair is raising into standing. The repose cushion is going with it, and it's contributing to the person having an uncontrolled stand from the chair. And also, obviously, adding a cushion to the seat is going to reduce the depth between the cushion and the top of the armrest, which can mean that the person doesn't have the leverage to help with pushing off and into standing. I've included a picture of this chair here, which just has a different type of material on it, so can be more easily wiped down, so can be suitable in multi-use environments, or if you're lucky enough to work in an area that provides riser recliner chairs, might be a preferred option, because from an infection control point of view, it can be more easily cleaned and reissued. With riser recliner chairs, it's important to look at single or dual motor, and also tilt in space is really important. So as the name suggests, the single motors have one motor that controls the backrest and the footrest at the same time. They're often a little bit cheaper. Handset is normally a little bit simpler to use, as it would only have the 2 buttons, one for reclining and raising the footrest, and then the other to move the chair to its upright position and then again into standing. But that does mean that options for adjusting are limited, so a person might struggle to get a more comfortable position. The dual motor gives a bit more flexibility, but with that comes more buttons on the control, so that can be a little bit more confusing for people to use, especially if they're starting to develop some cognitive changes. Tilt in space would always be a preferred option for any riser recliner chair. If a person already has a riser recliner and it doesn't have tilt in space, it can often lead to increased shearing of the skin, or the person's position can also quickly change, which would increase the risk of them sliding forward on the chair, especially if they're pressing the wrong buttons. I've had people that are trying to sit themselves up and they're reclining, and before you know it, they're going back and forth 10 times and they've slid forward 5 inches. So those are things just to be mindful of. I would move on from a riser recliner chair into more specialist seating if the seat height is too high. If the seat height is too low and it can't be raised with specialist raisers, so it's then impacting on a person's ability to transfer safely and independently, or it's placing strain on the carers. I'd also consider moving on to something else if the seat is too high. So getting seated further back on the chair is tricky, meaning that the person is sitting in pelvic tilt, placing more pressure on the sacrum. If the chair doesn't meet a person's postural needs, it might be too wide, the armrests aren't offering the support, or the backrest just doesn't support the person in an upright position. If the chair isn't compatible with transfer aids, so a lot of riser recliners are compatible, but you do need to check. If the width of the base of the chair is too wide, it can hinder legs of equipment getting around the chair, such as the Sara Steady. Or if the framework underneath the chair runs across the front of the seat, then that can hinder equipment getting too close as well, like the low lift or the return. Another reason to move on, the person's got higher needs in relation to their pressure relief. They've got current pressure sore, risk of pressure sores developing from dyskinetic movements, which increase the risk of skin damage. And another reason is the chair doesn't have tilt in space. when adjusting the backrest, it can cause them to move forward on the seat, which, as I said earlier, can increase the risk of shearing or falling. The next stage from a more basic style of riser recliner is this mobile riser recliner. Sort of pitch it in between a standard riser recliner and a more specialist care chair. It offers a bit more bespoke postural and pressure relief options, whilst also maintaining somebody's ability to stand while they can. It would also allow the person to more easily be moved between rooms while they still remain seated. So that offers flexibility within a person's home, also in a multi-use environment. It can help the person to conserve energy and reduce their fatigue by reducing the number of transfers. On this type of chair, pressure needs can be taken into account in terms of the seat cushion, using visco or gel or air, depending on the level of risk. And the backrests are interchangeable as well, depending on the person's postural needs. And then when a person has higher needs in relation to posture and pressure care, this is when we want to move on to much more specialist seating. The chairs are generally a lot more customizable, as they're modular. Parts can be switched out as a person's needs change, or if a part becomes damaged, if it goes back into stock for reissue. On these types of chairs, the pressure relief extends further than the seat cushion, and generally down onto the leg rest, so that offers better protection in terms of skin integrity. And we'd also be looking on these sorts of chairs for a footrest, so it provides feedback to the person so they can more comfortably sit. Generally more compatible with transfer aids. For those that are being hoisted, you can approach from the side of the chair rather than front, so it gives you a much better starting position for the person when they're seated. For anybody that's using these chairs that are hoisted, just one consideration is that you need to look at a sling that maybe remains in place. Removing and refitting the sling can lead to shearing of the skin, but also if you have people that are dealing with manual handling that maybe aren't quite as experienced, then a person may inadvertently move as the sling is being inserted and refitted. Oh, going back to that, I think Ben is going to be looking more at these chairs towards the end of this presentation, so you can see them in person then. Funding, quite often difficult if you're trying to get funding for chairs via statutory services, so you really need to make sure that you've got some sound clinical reasoning when you're approaching your fund holders. I've worked across several different local authorities that have different criteria for seating. I've worked with local authorities that will provide basic seating, like your height adjustable upright chairs. They'll also provide riser recliners as standard, and then consider specialist seating on a case-by-case basis. And I've also worked in local authorities that do not provide any type of seating, but will consider on a case-by-case basis the much more specialist seating. And quite often those would be ordered through a non-standard order process. If somebody's CHC funded, then obviously the request normally would go to panel. They normally request a few different options for cost comparison. It might be an option to consider joint funding between health and social care. If I've done that quite a few times, where a local authority has said, when somebody has pressure needs, that's a health need. Yes, they've got social needs from a manual handling point of view, but we need to explore health as well. And it's been a longer process to secure funding, but it's been achieved, and health and social services have then gone 50-50. And obviously there are times when a person's able to fund the chair themselves. There might be opportunities for someone to rent a chair if the outright cost is unaffordable, or it might be an option to explore charitable funding as well. I know Parkinson's UK can offer a grant up to about £1,500 that can be used towards equipment. It's also worthwhile looking at the person's employment history as well, and not just the person but their spouse, because employment history can open doors for various grants. There are lots of different charities for a number of different occupations. There's a bank workers charity, there's a hair and beauty charity, there's farming charity, and there's obviously armed forces charity. So if anybody has that sort of employment history, then approaching those charities may be useful. But one thing to note with the charitable funding is that they often have set times of the year where they will consider provision of grants. So there might be a lengthy wait if you put an application in for funding and you've just missed the last opening. I think that is it from me. Sorry, I've talked for a fair bit longer than I think I was meant to. I'm going to hand it back to Braden, and then I'll have a read through the chat for any questions and can answer at the end. Thank you.
Thank you very, very much for that, Caroline. That was extremely helpful. It's
No problem.
You've clearly got a huge amount of experience, so appreciate you coming on and sharing a little bit of it. And I'm sure people will have questions. There's been a couple on there. Thank you, Susan, for putting those on. So we'll address those at the end. But again, if anyone else has got any, please do pop them on the chat. For now, I will hand it over to Ben Sterling. So as I mentioned, he's going to run through some of the chairs which are from within our range. I do just want to mention that all of the photos of chairs which were in your presentation, Caroline, those are all from our range, actually, right from the very basic rise recliners, which we do offer, right through to the very specialist, the care chairs and the seating solutions with the different arms, the backrest, the pressure care, the postural options. So that they are all available to read more about on our website if you do want to have a look. And when we send around a recording of this afterwards, on the email, we'll provide links to some of the chairs that have been mentioned so you can have a look. But for now, Ben, I will hand over to you.
Brilliant. Thank you, Braden. And yeah, thank you very much for that as well, Caroline, earlier. Very thorough, very in-depth. I appreciate there might be a lot that is being covered and people might have questions on, so do get them in. Like Braden said, and thank you, Caroline, for doing it, we've kind of seen all the chairs already through the presentation there, but what I want to do is just kind of run through some of the functions of it. The main chair that I want to kind of cover today is this particular one here. It's a Lento Mobile rise recliner. Absolutely bang on line with what Caroline was saying in terms of what we're looking to do with this. It is a hybrid chair between your care chair and your rise recliner. So with Parkinson's, it's been designed specifically with that in mind, but has a range of other support and uses in other capabilities for other people. But the main point of this is we want to promote independence with that individual for as long as possible, but ensure that they've got good postural support, and actually that this chair can hopefully cover for the majority of the journey that they have with us. So if they, we don't want them to have to keep buying chair after chair after chair or upgrading the chair constantly as the condition and their journey goes with the condition. We want to actually catch it all at the same time right at the beginning. And so what we've done to kind of achieve that, we have got underneath at the back of the chair, we've got a hand screw that you can just loosen off. You won't be actually able to see it on the video today, but believe me, it's there. Just a hand screw underneath at the back. And what we can do then, we can actually adjust the width of this chair very quickly to ensure that we're getting to the right sort of size and width for that individual. What we can also do with this chair is we can actually take the arm off completely. So from a hoisting point of view, you can hoist into this. You can also use like standards like Sara Steady. It is Sara Steady compatible. As Caroline alluded to, you might struggle with a return on this because the bar is quite close to the front there, but most of the time we found that Sara Steadies are generally the kind of one that people tend to use, and it is compatible with that. But when you take the arm off, you've then got 2 pins on the side here, which you can actually use to adjust the arm height of the chair as well. So you can actually bring that up or take it back down. And then you can actually see from there, you're actually able to adjust the arm height. So with seat width, you've got the ability to adjust between 15 inches to 22 inches. In terms of arm height, you've got the ability to adjust from 6 inches to 9 inches from that as well. Now, this chair also gives you the ability to adjust the depth. So that screen that we had before in terms of all the measurements that we're needing when we're assessing, so width, depth, arm height, all of those things are kind of covered very, very much straight away within this. The other thing that was inches of vertical rise before we actually tip and the chair starts to progress forward. We've designed that for 2 reasons. One, to actually help obviously get a person up and out of the chair safely, but also those first few inches can actually just be used to improve the seat height of the chair. So very quickly we're adjusting and making the chair fit the individual and ensuring that they're actually going to be comfortable and supported in the best possible way. Now on this chair, it is on casters, it is mobile. We've got this, we'll limit the number of transfers in a day. Each one is braked, so you can lock it and secure it in place when you're happy with where you are. And on our chairs as well, we have in this chair as standard is tilting space. We've got a single motor tilting space version here. So what will happen on this one, the chair will tilt, not the backrest doesn't open on this one, not on the powered side of things, we can do it manually, but we have tilting space and leg elevation as standard within this chair. Okay, so that patient is being supported and their weight is being evenly distributed throughout the chair very easily and very quickly. You can upgrade to a dual motor, so you could have a back angle adjustment as well. But again, as Caroline has alluded to today, we don't want to make it too complicated or too complex when the main real positioning tool that we have that works to our benefit the most is tilting space. So as long as we've got that in there, it's a good place to start. And the good news with this chair is if at any point you decided you do actually need the back angle adjustment, you can actually upgrade this as it is. So you're not having to buy a whole new chair. You're literally just popping an extra motor on the back and we would replace the remote. And so then you've instantly upgraded to that full capability if you wanted to. What we've also got on here as standard is our waterfall lateral cushion. What we're looking to do with that is just give as much support as possible without too much intrusion on the individual. And so these lateral cushions here give a good central line, good support, and you can adjust the wadding in each of these. They are all interchangeable. You can swap them any which way around you like. You don't have to have the laterals if you don't want. And if you're needing something firmer at the back of the chair, you have got the ability here to add in thoracic laterals. We wouldn't necessarily suggest or recommend that they go straight on the skin. We'd recommend have the lateral cushion, get your thoracic around the side, and then you can keep that person supported, but also comfortable at the same time. On the chair, within pressure, with regards to pressure relief, we have got the ability to take off this overlay. So all our pressure relief is actually built into the chair. Reason for that, as Caroline was mentioning about the repose cushions, obviously you stick a cushion over the top of these chairs, you're then going to affect your arm height, you're going to have to affect, you're going to be affecting seat height maybe a little bit as well. So that's not always the best thing. So we integrate it into the chair. So as standard, we have a medium pressure relief. So we've got a good medium pressure care within this chair as standard. You would take the overlay off and you can then replace that with a gel overlay if you wish to just increase that. You can even go as high as an alternating air cushion. So the same technology as you get in your mattresses on hospital beds, you could actually fit that into this chair as well. We'd have a battery pack at the back so that you're still mobile, but able to give that person maximum sort of support. Now, what's been alluded to in today is that whilst this has kind of got a lot of things going for it, we really do need to bear in mind the journey of the individual and where they're actually at, you know, in terms of their support, their posture and things, and their tone. Dyskinesia has been mentioned as well. And so all of these things are quite important to take into consideration. As I said, this is one that would cover most things, but there are always exceptions to that rule, as I'm sure you know. And so it might be the case that we need to think a little bit further. We need to maybe take it up a step. And so as was shown before, we do have a care chair option. So this would be more for people that are hoisted. So maybe the journey is that they're no longer independent, and the more they're being hoisted more than they're able to move themselves. And any movement they make themselves is maybe a risk and maybe something that they can't particularly carry on. We want to keep them there as long as possible, but if needs be, we can then move into this sort of chair, and on this we can then add further accessories to provide a bit more support to that individual. We've still got width adjustment, depth adjustment. We've still got the ability to add accessories to this chair as well, should the need arise on that one. The final chair, it's a bit maybe out of the box thinking, but this is definitely one that I've used for the dyskinesia that was mentioned. It's the Lento Neuro. It does have a raked seat as standard in the chair. Now, it's quite important to note because, again, Caroline mentioned it before, we don't necessarily want to be strapping them up with belts and getting all the supports in place if we can help it. We want to actually give this person as much freedom and comfort as possible, but obviously give them a bit more, keep them safe at the same time. And so this chair with the raked seat and the raked action on there, you can actually come right the way down and support them in a nice raked fashion, so they're not going to actually slip out of the chair, as has been mentioned. We've got width adjustment on here. Again, same principle, you just loosen 2 screws at the back, and then you're able to actually bring the seat width out or bring the seat width forward, depending on what you're wanting. You've also got the ability to swap cushions out on this one. And also with this, you can actually bring about a foot plate on the side there as well, just connect that to it. Now, again, it's not always needed, but it comes as standard with the chair, so you've got the option should you wish. The only other thing I would say is with these chairs and with this particular one, with the remote, we've put it on a magnet on the side. We've also got the ability to have it magnetized at the back, depending on how the person responds to that, whether they can be trusted or not with it. The reason for that is to help from a postural point of view. Standardized recliners, they always have a little loop where the remote is, and you sit somebody in, you'll get the pelvis right, you'll have the depth, everything as it should be. The arms are nicely high up, they're well supported, and then you go, right, go for it. Do you want to tilt yourself back? And they'll look for the remote, and they'll do this sort of motion, and eventually they find it, and then they're sat like this. So having it as a magnet just on the side here where they can reach and they can tilt themselves back just ensures that they're getting the best possible, keeping the best possible posture, but getting the access to it very quickly. We can also improve the buttons. So if their dexterity isn't the best and they're starting to not able to quite push the button in and make it powered, we can actually improve upon that as well, just make it a bit more sensitive so that their touching on the chair can actually do the functions that it needs to. And again, just improves it, keeps that independence for a little bit longer, and it just gives them that support that they need. And then when it comes to coming out of the chair, it's literally just a stand-up motion. But as I say, that vertical rise just ensures that we've got a good perch position before we start feeling that chair push forward, which is also quite important. Just quickly, some of the common accessories on all of these chairs that we would tend to have would be along the lines of maybe an extended wing to actually house them a bit better, maybe a cocoon backrest just to support them from pelvis up to shoulders, thoracic laterals. In the care chair world, maybe a lap belt, but again, we try and stay away from that as much as possible to just ensure the person's kept safe. The tilting space on this chair does have quite a significant tilt to it, so the last thing you want to do is add that in the mix with along with the lap belt as well, if you can help it. So you have got a good range there. I think that pretty much covers everything. some of these chairs, if you've been on the previous webinars, you will have seen before. So they do cover quite a range of conditions and needs. But I'd say, like I said, Lento Mobile is probably the key place to start, and a good hybrid, a good halfway house between offering the support of a care chair, but giving the independence to that individual, which is quite vital in a lot of cases.
Brilliant. Thanks very, very much, Ben. And just to everyone watching, Ben, as I mentioned, is one of our assessors. So if you want to find out more about these chairs, or you actually want to try one of these chairs with a client, depending on where you are in the country, we can actually come. Ben can have a chat with you and bring the chairs which we think would suit an individual patient the best, or otherwise it might be Ben's colleague Harry who comes along, and we can actually try those chairs. Otherwise, we can do demonstrations over video as well, personalized ones, and just bring you through an individual client's needs to see what might work for them. So please do feel free to get in touch about any of this afterwards. But for now, let's just move on to these questions. I'm aware of the time, so I don't want to waste anyone's time. I know everyone's busy, so we'll just move on to the questions now. Thank you to those who have sent them in. So to start with, I've got Susan, who's asking about the repose contour cushions that you've been talking about, Caroline. So just asking what those are, what type of pressure relief do they have, and are they compatible to put on a rise recliner chair? And then is there a risk of it sliding off?
Okay. While Ben was chatting, I've just put a couple of, can everybody see that?
Yes. Yeah.
Yeah. So that's just your bog standard repose cushion for anybody that's not seen one, that would sit on a standard upright chair. And this is the contour. So you've got this in a much longer form with a cover over it as well, and that's designed for riser recliners, so that as somebody reclines back, you get a bit of pressure relief on the spine and on the calves as well. And yes, like hopefully I sort of said during the presentation, there are risks that they can slip off. You know, these do strap around chairs, but in my experience, if they become loose and people aren't really on the ball with checking the straps and the fitting, then yes, it can contribute to somebody sliding forward on the seat. And I've removed them in the past when the risks have just been too high. In terms of pressure relief, they're kind of your entry level pressure relief. So for anybody that's considered at risk, but that maybe doesn't have current pressure sores. So it's your more entry level pressure relief. What was the other question? Oh yeah, no,
Thanks.
I answered that one. Yeah, okay. Does that answer the
Cool.
question? Hopefully it does. Yeah.
I think so. If you've got any more you want to ask, Susan, feel free to pop it on the chat. But thank you, Caroline. No, that's helpful. I then got one from.
Just to jump in on that as well. If you're curious in terms of how that compares to the chairs that we have here, so that is. Those repose cushions are essentially the same entry level as our pressure cushions here. So everything you see here is equivalent to that repose cushion you see. So that's the basic level. And then we can go up to gel, then we can go up to alternating air. So there is a lot more scope within these chairs. So if you're wondering how does it compare to one of these, that's it there.
Yeah, brilliant. Thanks, Ben. Brilliant. And then we got another question from Lydia for you, Caroline. About employment charities that you talked about. Are they specific to Parkinson's patients, or can other patients apply for these grants?
No, all and everybody, as long as there is an employment history in those industries. And some charities have, you know, they need to have worked in the industry for a set period of time. Others, you know, like SAFA, the Armed Forces charity, somebody may have been in employment for a day, they will still be able to apply for for grants. Obviously, the Parkinson's UK charity grant is for Parkinson's and the Parkinson's plus type conditions, but for the employment charities, then no, it's for anything and anyone.
Brilliant, thank you. That's actually the only two questions we've got on there today. Now, if anyone does have any more questions, please do feel free to get in touch afterwards. Again, we're always willing to have just a casual chat with you to answer your questions. So I will just share my screen again and just quickly show you where to go in if you want any further resources, and then just wrap up the session today. So we've done our question and answer session now. So just to point out that you can go on our website and we have a resources section. So there is literally a button on the main menu of our website called Our Resources, and it includes all sorts of things that you can read or use, such as assessment checklists. So you can bring these with you when you're actually going on assessments, just to remind you of all the different things to consider and the steps to take, the measurements to make. So this can be really helpful. It can be printed off and used, or used on your phone or a laptop. But there's a huge amount more that you can use within our resources section as well if you need. So there's actually justification templates for the chairs if you are really trying to get that funding through, as a place to try and put forward some of those arguments for getting a new chair for an individual patient. And then we've got ebooks around assessments, around accessories on seating, and then we've got blog articles, previous webinars, videos, a huge amount of other things. So please do go and have a look and take advantage of it as much as you can. It's there for healthcare professionals like yourselves to use, and to bring better outcomes to the clients that you're working with and trying to help. So that's just a word on that. In terms of future webinars, we're actually going to be live in January for our next one. So that will be episode 9 of this series, and that's going to be all about postural support within seating. So it's going to be a bit of a different format to our previous ones this year, but it's going to be really exciting. We've got another OT joining us with a lot of experience. So keep an eye out for the announcement of this when it's live, and then you can register for that on our website. For now, though, that is it for today. I thank you very, very much to everyone for joining. Again, really appreciate you giving us your time this afternoon, and thank you, Caroline, again, very, very much for your time and for your presentation. It was very helpful.
Thank you.
That's okay. We are actually going to be at the OT show this week, so please do feel free to come by and say hello, try the chairs that we've got. We're actually running a free chair giveaway for a client. So if you come and register your details with us at the show, you will be in for a chance to win a free assessment and then a free chair of your choice for a client following that. So do come past, say hello, and register your details. We'll be glad to see you. But thank you very much, and have a great rest of your afternoon, and we'll catch up again with you soon. Thank you all.